So let me start with Michael Neidorff. Michael, thank you very much for coming to us. Michael is based in St. Louis, and thank you. He's coming to us from his offices in St. Louis. Let me give you a brief overview of Michael's incredible accomplishments. I've known Michael for many years and quite proud to call him a friend of mine, but let me give you some of this interesting background. Michael is a native of Altoona, Pennsylvania, went to Trinity College, Trinity University in Texas, and got into the healthcare world. And he, in 1996, became the CEO of Centene. Since that time, Centene has had its revenue go from roughly $40 million in 1996 to roughly $112 billion now, I believe this year, something like that. In addition, the company went public in 2001, and the company's stock is up roughly 100 plus times since then, so I wish I had invested in it then. Centene does so much work around the country that I think one of every 15 citizens in the United States has healthcare services provided by Centene. Michael is also involved in the philanthropic world extensively. I've gotten to know him through the Kennedy Center, where he's been a board member. Also, he is the treasurer of the Kennedy Center, and I was able to persuade him, thankfully, to chair our capital campaign committee, so that the $200+ million we raised for the REACH was really due to Michael's work and legendary arm twisting. And we raised that thanks to Michael's effort and his own generosity as well. Michael's very involved as well in the National Urban League. He was the chair of the National Urban League for a number of years, also the chair of the St. Louis Symphony, and a variety of other philanthropic activities that are too numerous to mention. So Michael, you obviously know a lot about healthcare. So tell us, basically, do you think the worst is over for the United States in having to deal with the COVID crisis? Or based on the information you're getting from all the people you have around the country, you operate in all 50 states, do you think we still have very big healthcare problems that the United States has to deal with?
I wish I could say I think it's over, but I think we have a road to travel. The epidemiologists I work with and public health people feel that there probably will be a couple smaller spikes this summer, and we're at risk for a larger spike in November. And a lot of this has to do with the social distancing, the use of masks, things of that nature. And it's a cultural thing that we have to overcome.
Okay, so Michael, let me ask you, do you wear masks when you're dealing with things? You have your mask there, okay. So you have a big company. You have about, how many employees do you have? 20 something?
70,000.
70,000 employees. Okay, so where are you running your company from? Your office where you are now, or have you been running it from your home, or how have you been running it?
Well, I've been basically at home because I want people who are working at home to feel comfortable. If they see me in the office, they may feel they have to be. But this is the 8th floor where we are. It's very secure and it's safe. There's very few of us up here. But I'm very proud. We moved in 3 days' time, 66,000 people home to work, and the operation continues to function completely as it normally would.
Okay, so today, would you say that in hindsight, the United States healthcare system could have done better things to deal with COVID-19, or you think we did the best we could?
I think, without being politic, just looking at the science of it, I think we could have done better. I think people I've talked to say what we're lacking is a national policy. And that keeps everybody united in the approach to do it. And I think in retrospect, that may have been some help.
And what about the information you have about vaccines? Many people say without a vaccine, people will never feel comfortable coming back to work. Do you think there's any prospect of a vaccine at, say, by the end of this year, or early next year, or not so?
I hear it. I pray for it. Having worked at Miles and Bayer and knowing what it takes to develop drugs, and test them, ensure what the side effects are and things. It is a challenge to get one out that fast. Our computer technology helps, but some things just take time. I would emphasize, David, if I may, though, that next to the vaccine, the most important thing you can do is this mask. And an epidemiologist pointed out to me that in Japan, where there's 127 million people, and they've always had in Asia a mass mentality. When we had 100,000 people die, they had 832. In Hong Kong, with 7 million people in a congested area, they had 4 people die in the same time zone. This is the next best thing until we have a vaccine.
So, Michael, let me ask you this. I didn't do a good job of describing what you actually do in your company. What does your company actually do for people?
We're in government services healthcare, and we are the largest Medicaid provider, which means the states contract with us to provide the medical care for people on Medicaid. We are the largest Affordable Care Act provider in the country. We're the largest, or close to the largest, long-term care. So we're in government services healthcare. And we have some specialty companies, we have some international operations that operate hospitals and other health systems in England, Spain. So it's a multinational. We're in all 50 states. And as you highlighted, we cover about 1 out of every 15 Americans.
So explain to me, let's suppose I'm on Medicare and I go to the hospital and I need medical treatment. What does your company do if I'm a client of yours?
We are providing your insurance if you've signed up for us, and we manage the care. We do everything we can to ensure the highest quality care and that you get the services you need in a timely fashion.
So explain this though, us. Medicare seemed to be growing exponentially in terms of the federal budget. Can we really afford the Medicare that we are now giving everybody or people are getting because it's just costing so much money? How do we deal with Medicare costs, or is it not a problem?
Well, I think the Medicare, it's an issue, but I think we have to get out, we're bringing efficiency to it. And I think that's really clearly why the private sector is growing faster than the Medicaid fee-for-service side. In the Medicaid side of it, the managed care clearly saves a lot of money for the states and the government. Our average premium increases the last 5-8 years have been about 1.5% to 2% a year. So managing the care, improving the quality, and we maintain the highest quality is the least expensive.
So without getting into the politics of it, is the Affordable Care Act helping people or not? And how does it help your company in terms of administering healthcare programs?
I think the Affordable Care Act is achieving, as you said, outside the politics of it, what people want. The best indicator is that 80 to 90% of the individuals that we have in a given year re-up the following year. So there's a satisfaction. People want to have insurance. They don't want to, they like having that card at an affordable basis.
So what happens if somebody doesn't have insurance and they get injured, they go to an emergency room? Who actually pays for that? Does the hospital pay for it, or who pays for that?
Well, the hospital covers it, but you and I as employers pay for it because that gets cost shifted to our premiums that we have to pay for insurance.
So how do you compare the healthcare system in this country to, let's say, those in Europe or Asia? You think we are better for wealthy people or not as good for poorer people, or how would you compare it?
I think we're better for everyone. You know, everybody likes to talk about the single payer, but people have to realize the single payers contain costs by restricted access. And they, you know, I look at European countries where they have a public and private sector. Anybody that can get close to affording the private coverage does it. Because if you're 65 or so and you need a knee replacement, there's no telling when you would get it. So I think our system serves well. We just have to cut out some of the waste that's there and ensure that it's efficient. And we're doing just that. There are ways to do that.
So do you believe that that the elderly people who are, let's say, I don't hate to say what elderly is, but people who are older than the average person in the United States, they have been affected by COVID adversely? Is that because their immune system is weaker? And do your statistics show that people who are dying disproportionately are both older and minority?
Yes, I think what you are finding, there are people with greater heart health risks. Smokers are clearly at greater risk. That's why in some countries where you see more men are affected than women because there's more men that smoke. So it's a combination of factors. The minority communities, I think, have been affected in part. The ones we work with have great access to care. But I think that they live in closer quarters. The density of their population is greater, which means that the social separations are tougher. There's a number of factors. There's no one factor you can point to.
So, Michael, you were in your early 70s, so you look like you're in pretty good shape. What do you do to stay healthy? And is the best way to stay healthy, based on your statistics and your experience, good genes, exercising, eating well, or being interviewed by me? What do you think the answer is?
Obviously, being interviewed by you keeps us alert and
Right.
very astute. So, I mean, that always will help. I think genes can never hurt you, but it's a lifestyle thing. I had an aunt that lived to be 94 and was still practicing law, and she used to say age is a number. But I think anything in moderation is appropriate. Exercise is important. I have a gym in my basement and a trainer that shows up before the COVID every morning at 5:30 for a workout. So I think you need to do that. So I eat red meat 3-4 times a month, but anything in moderation. Just think about what you're doing. Avoid salt and high fat.
I have a gym in my basement, but I just look at it. I actually think by osmosis, if you walk past this, maybe it'll run off. It hasn't worked yet. So let me ask you, how did you grow your company from the level that you had in 1996? To be honest, it's an exponential growth that's very difficult to figure out how anybody could do that in a non-tech area. Let's say Google or Microsoft or Facebook may be different, but yours is not a technology company in that sense. So how did you grow this company? What was the secret to it?
Well, I was blessed. When I was at Miles and we were bought by Bayer, I worked on reorganizing the two companies as a team. I learned the term key factors for success. And as soon as we moved into this company, we identified those. It was systems, it was networks, it was things of that nature that we laid out. And it's still factors we focus on. But I attribute it to having just the right people helping me. I have people who have been with me for 18, 19 years. My chief of staff just retired after 31 years, having worked with me in 3-4 companies. So there's a consistency. But we also have one philosophy, and that's everybody in this company has a sense of responsibility, accountability, and authority. And we operate under what Psychological Associates calls Q4. Now, if I'm in a meeting with my staff of 10 people, they all know I have 11 votes, that I'm accountable. But they also know that I have an obligation to hear them out completely, get all their points of view before I make that decision. People are able to work with it. I also have to call out, I've had great bankers helping me. I had Leroy Kim and Allen and Company, and every bank in the country knows we do nothing but work with others, but they're always involved. We have people whose counsel really we can depend on and will tell us when our eyes are brown because we're full of mud, and we depend on that.
So some people say they have a hard time getting something reimbursed by insurance. This is a frequent complaint you may have heard of, where people say, I'm not getting reimbursed for this, and so forth and so on. And doctors often say when they're giving you services, well, this is not reimbursable. So do you see a lot of problems in that area where insurers just don't pay for certain services that people might want? And how would you address that problem?
Well, I think there's been too much of that, and it's unfortunate. It's how they fill out the claims and everything. We now are reorganizing our systems, IT, and we're focused on the member, the recipient experience, and the provider experience. And we want both to be very positive. And I envision a day when we have paperless claims and where there is no claims process, where it's just very simply done. That's where we have to move to, David.
And what about fraud? Do people fill out forms where there's fraud? And how do your people pick up fraud? In other words, if somebody says, I want to make some money that I don't deserve, I'm going to say I got this service or something. Is that a big problem for you?
No, it's there. We have a whole unit that focuses on that. And, they may get away with it for a short time, but we have algorithms that identify patterns, and it's very quickly identified. And
all right, so whoever the next president of the United States is, if he called you up and said, Michael, you know a lot about healthcare, I want to fix our healthcare system, give me 1 or 2 ideas that I can realistically do to fix our healthcare system, what would you recommend to the president?
We're working right now, and I would tell him, take Medicaid, which is to 138% of federal poverty level, back down to 100%. Those below 100%, bring them up to it. Take the ACA and cover and subsidize from 100% of federal poverty level to 400%. That will cost about $9 billion at the highest level, more likely $6 billion. Let's teach people to fish, how to use insurance, teach them to fish rather than give them a fish. I think there's things we can do, and there's other aspects of that we would add to it. But let's simplify it, and let's make it affordable and the highest, and let's reward quality in the system.
Now, Michael, when I first met you a number of years ago through the Kennedy Center, I learned about your company. I mistakenly didn't buy any stock in it, and I don't own any stock, unfortunately, now. But let's suppose I said I want to invest in healthcare, and I'm not going to buy your stock, let's say. Where would be a good area to invest in healthcare over the next 2 or 3 years that I think is going to see a big increase in value of the companies?
Well, unfortunately, they've also taken off to a great extent because I've looked at it at multiple ways. But I think healthcare as we know it today is going to change through technology. And it's the point I should have made earlier that when things get out of control cost-wise, technology always comes in. And I think genomes is the answer, mapping one's genes. I don't think we'll need hospitals in the next 10 years as we know them today. You're going to go in, they're going to draw your blood, map your genome. The churches allow embryonic cells. They have more than enough cells. They're going to mix something up that's curative. Hospitals will do trauma, OB, and some joint replacements and things. So I think what you look at companies that are moving in that direction. And I think you'll long-term do very well.
So what have you learned as a final question from this experience? In other words, you've been working from home, you've been managing your company from home. What have you learned about running your company remotely? And what have you learned about yourself through this whole experience?
Well, I think what I've learned is how incredible my team is. That the dedication to the most vulnerable population that we serve is there. And that really good people in any circumstance will only work one way, the best they can. And we have not missed a beat, in my opinion, in serving people. Myself, I learned that I enjoy coming in the office. I enjoy the interaction with people, and that we can be more efficient in using things like Zoom. We're going to be doing more and more of that. We're looking at telemedicine, our own version of it. So what I've learned is that technology there can be very effective. I'd much rather be sitting in a studio with you right now, David, but we are able to get this interview done.
So again, this will be the final question. You led our effort to raise about $260 million, I guess, or so for the Kennedy Center's campaign for the REACH. What was the key to twisting people's arms and getting that done?
I think there's two things. I think one, it wasn't I, it was we. You were in the middle of it and a great help, and the staff at the center played a key role. But I was blessed to be in a position to make significant donations myself and through our company, so that we're able to say to people, join us. And people, will react to that. When you say, look, this is what we're doing. I'd like you to become part of it. And I think that's key to any time you're raising funds.
Michael, thank you very much for your help at the Kennedy Center and coming on this morning. And I hope you stay as healthy as you look today. And I will try to work out myself. I'm going to actually try my equipment someday.
Please be safe. We need you, David.
Okay. All right. Thanks a lot, Michael.